Acute pyelonephritis. Acute means sudden. Pyelonephritis. So, pyelonephritis is actually affecting the renal pelvis. So, there is an acute inflammation and infection of the upper urinary tract, which might be coexisting with the cystitis also. So, here we can see that there will be streaks of pus and there might be abscess in the medullary cortical regions of the kidney, and due to which there will be various manifestation that can be seen. Acute pyelonephritis is more commonly in females because of various reasons, that because of vesico-ureteric reflex, or because of the short urethra, which is 4 centimeter, and also because of the periurethral infections due to the location of the urethra near the anus. So these are some of the factors which actually makes it more female sex predilection. And coming to the symptoms, we have that the patient will present with pain, and usually it is loin to groin pain, means it will start in the flanks and it will be migrating till the groin region and also in the suprapubic region. Second is, since it is acute in onset, so if the patient and if there is an infection, so usually a patient will present with fever, chills and rigors. Coming to the elicitation, the signs, so there will be renal angle tenderness. Renal angle is basically the lateral border of the erector spinae and the 12th rib. So between that there will be renal angle tenderness. There will be guarding might be present, and patient is usually having frequent micturition, which is scalding, and also it will be having pus and foul discharge because of the pus discharge, and patient will have severe abdominal pain, mostly in the flanks. Uh, then coming to the causative organisms, usually E. coli, Klebsiella, Proteus, Enterobacter, these are the common organisms that tend to cause acute pyelonephritis. Now coming to the management. Management includes the investigation and the treatment part. So management is, first is the investigation that I'll go for will be blood tests, the routine blood test, and urine routine and microscopic examination. So we can find the presence of the organisms, the pus cells, the WBCs, the elevated, there might be RBC cell casts which might be present. The culture might be positive. And we can also go for the DMSA scan, which is dimercaptosuccinic acid scan. It is more of the, it will confirm the diagnosis. USG is not much of importance. CT scan can be done to look for any abscess or any hemorrhagic cause or any masses that might be the reason, calculus that might be the reason for the infection. Then the treatment part is that since the patient is having pain, we have to start giving analgesia, analgesics, and we have to give IV fluids. They might be very toxic. Patient should be started with IV antibiotics, usually third generation cephalosporins or fluoroquinolones can be added. Aminoglycoside group of drugs can be given to the patient. The diet should have the usually we have to make the urine more alkaline, so we can give citralca syrup, which is to be given as 20 ml syrup that has to be mixed with water and should be drunk. The patient should take it at night, and along with the antibiotics and analgesics, and they are supposed to drink about 2 to 3 liters of water per day in order to flush out if there is any minor calculus, and just to increase the flushing out of the bacteria and toxins. And even flush therapy can be given if there is any calculus which is leading to acute pyelonephritis. And the patient should be followed. The For the fever, we can give antibiotics like paracetamol, and bed rest has to be they should take good bed rest, and uh, that's how we will manage this acute pyelonephritis.